I'm Dr. Chris Abel, Neenah Family Chiropractic. Welcome visitors and guests to BizBuzz. Tonight's my 10-minute presentation. In the beginning, I'd like to tell a little bit about myself and my business, me and my wife. We've been in downtown Neenah for 6.5 years, roughly. My wife and I were both chiropractors. We're both going to be in the building off and on. We try to keep it an intimate setting. It's a small clinic ran by her and I. Sometimes we'll even get to meet our 1-year-old son in the clinic. It creates a more family-type, comfortable atmosphere, I think. We try to answer everybody's questions thoroughly before we do anything with them. A little bit of history about me. I come from a family of 9 kids, 8 brothers and sisters, all from the same parents. Went to Catholic school when I grew up and stayed in school for most of my life, I guess. Went to the University of Minnesota Duluth for college and then graduated from Northwestern Health Sciences University for College of Chiropractic in 2002. And what brought me to Neenah is all the lakes and all the great people. Of course, my wife thinks that all the plays and stuff like that are great in the area. So, to start the presentation, I've done this presentation with the group many times. A lot of times it just leads to questions and answers, so if anybody feels like breaking off and asking a question, feel free. But to get people more in line with what chiropractors think about versus people thinking I'm going to get my spine cracked is how we relate to your spine and your health. There's a lot of things people may or may not know about health and what the physical body can do and what part of the physical body can lead to worse health or better health. We work with the spine to work with the nerve system. Of course, the spine's major idea is to house the nervous system, hence the spinal cord and the skull. This is a very important part of the body because it controls and coordinates every part of your body, whether it's your skin tissue, your saliva glands, your heart, lungs, muscles, pain fibers. This all comes out of your spine, and at certain levels, this may cause irritation, causing a misalignment. In chiropractic, we call it vertical subluxation. This nerve irritation can be ongoing for a very long period of time or a short period of time. What it's doing is it's facilitating or exciting your nervous system, creating a pain pathway. If that pain pathway is there and there's misalignment where the vertebral body's not moving that much, that's kind of what we say in chiropractic is vertical subluxation. If that interference is there, over time, bad things can happen as far as causing problems in the rest of your body, meaning it doesn't adapt to stress as well, and you may have worse lung function, things like that. It kind of creates a reflex. Everybody knows what a dimmer light switch does. It makes the power go on brighter or less. When there's a vertebral subluxation, it doesn't mean that there is a total cutoff of the nerve, a pinched nerve, or anything like that. It just means it's facilitated, so it's getting more communication than it needs to one area versus another, so the light switch is dimmed at this time. And if you can find and correct that problem, you can turn the light on or make the nervous system function properly. Most people will see chiropractic for pain, but we also do see children or adults with asthma problems. It often reduces the duration and frequency of symptoms, whether or not we typically, I'm going to say we don't treat asthma, we work with the spine to reduce that interference in the body. We can have less interference there, by having less symptoms, makes things clear. We also work with people in their later ages because, of course, as you get older, things don't feel right, and we tend to try to find the one miracle that's going to help us, and of course, it's probably not out there. But gradually, people come in, get feeling better, and they can start doing things they haven't done for 10, 15 years, like going walks with their spouses and things like that. So what I have in the handout is some things it talks in the beginning about your spine, the upper cervical spine, your neck, your thoracic spine, which is your rib cage area, and then your lower back, which is also your lumbar spine. They also have different curves that are supposed to be there. Curves you do not want are lateral type curves. They call these scoliosis. A lot of people have scoliosis, but it's when they become more curved at 20 degrees is when you have to start finding surgical intervention for these types of problems. Usually if you catch a young person, you can hopefully prevent or reduce the lateral spinal curves for future reference. I have two picture things. They might be gross to some people, but it's just trying to give an idea. The one page is the autonomic or self-regulating nervous system. This is kind of on the outside of the spine, but does go into the spine at certain levels. From the autonomic nervous system photo, you can see the nerves coming out of the spine and going to different organs of the body to kind of relate to, yes, this guy's not crazy. These things do come out of the spine and can affect the nerve system. And then on the back of the last page, should be last page, I put this together so I don't know if it all comes together or not. But it shows, again, the vertebral column, the levels of the vertebral column, and types of symptoms of the tissues that might be having symptoms in that area. Like a lot of times people have sinus trouble. It's in the upper cervical spine where sinus troubles, headaches, that area where people have problems. It's usually up there, not always. Sometimes it's in the mid-back and stuff that may be creating headache problems. Not everybody's in the normal anatomy. Some nerves do branch off in different areas of different people. So it's not an exact area saying, I have a headache, adjust this one spot. You have to look a little more deeper than that. Two areas of the spine. Does anybody have any questions offhand? Now that you're all in depth on the pictures and the symptoms.
How much maintenance is involved in what you do?
Maintenance is totally up to the patient. It's always recommended that it's a patient choice. It's not covered by insurance. It's an out-of-pocket expense. But what the idea is I didn't talk about this, but there's something called spinal decay. There's a normal degenerative progression throughout life. As you get older, your spine degenerates. As you get older, your teeth probably need more care and trying to get an idea. So we call it spinal decay. It's where you get more bone spurring, the discs dehydrate. Spinal disc, here's my friend's spine. The spinal discs are cushions in between the bones. These things over time they're really hydrated when we're 18, they start dehydrating when we're 30, and it goes on and on. Some collapse and dehydrate faster than others. When you're in accidents, injuries, that also progresses degeneration. And when that happens, that collapses, you'll have more painful signs and symptoms. But to get back to Harry's discussion, I'm going to pass this around. But this shows where the nerves come out of the spine at each certain level and gives you the idea of where it can happen. But maintenance is totally up to the person. It's kind of geared toward when the symptoms are happening. If you're having headaches once a month, ideally you want to come in twice a month so you can prevent the headaches from happening. Yes, you can come in once a month possibly, but if your goal is to prevent it, you got to figure out the scheduling that we need to prevent that. There's also wellness care where it doesn't matter whether you're having symptoms or not, you're just on the idea that maintaining the spine is a good thing, that you want to increase your odds of the future to have better motion in later years of life, so you're not as stiff and a little more able to do the things you want to do. This is the idea of what we're trying to do as far as maintenance and wellness care, is to create better function in the body so it's better able to respond to stress in the world around them.